I'm glad there's somebody like acupuncture. If not, I'm gonna be sad today. Nah, just kidding. Okay, so thank you for giving me this opportunity to share what I do and daily basics and helping patients. So briefly, I'll introduce myself. This is me, and I'm born and raised in Taiwan. My undergrad is on public health in Kaohsiung Medical Universities, and I went China for my Chinese medicine degree, and I'm licensed in China, and also the licensed acupuncturist in Hawaii. So in China, the actually we're learning the medicines in two systems, both Western systems and the Chinese medicine systems. So that the hospital we were like training at is the modern hospital settings, and with two systems combined in ones. So we actually can see the combo of Western medicines and the traditional Chinese medicines, the herbs, the acupuncture, and the tuina, which is the massage. So how that into play. So I don't know I think so many people already know what's acupuncture, right? So somebody might experience acupuncture. So very straightforward. It's a needle. This pictures, I always show it to the first time my patients that the initial visit, especially they are afraid of the needles or they've been traumatized with blood drawing, right? So I show them that actually, one injection needles actually can hold like 20, 30 of the acupuncture needles. And I let them touch and play with it. And it's like, oh, it's so thin. I say, yeah, it's thinner than your hair. So don't be afraid. Don't get me wrong. I have patients with like full tattoos in the arms, in the bodies, and they are scared of the needles as well. But hey, I cannot help. But that's just how I to comfort the patients in the first place and let them know, actually don't scare and it's gonna help you. So with needles, there's a point. That's how it works. Okay, this is a very couple like strong points, like we call it stomach 36 on your left hand side on the legs, on the just below the knee. These points actually is very strong points to help with your wellness and your like GI issues, and also immune systems or the fertility part. And sometimes by massage, you don't even need to use needles. That you can actually help yourself with like daily wellness. And on the right hand side, this is the PC6. This is a very good point for like motion sickness, nausea, upset stomach, and carpal tunnel and headaches due to the stomach problems. So this is the couple points. And the next one, the LI4. This is a very strong. This points, it's one of the best that you have a headaches, eye problems, fevers, or like toothaches. This is the points to like massage or to press and to like relieve the pain. And the next one on your right hand side, the in tongue on the red dots, that's a soothing point. This is the like for pain, this is the goal for points to help everything kind of settle or like stress. So everything like smooth. That they call it the third eye, but you puncture into the third eye, but just make you all calm. So, like how they in the old times, they like smart Chinese ancient people, they combine all the points together, 2 dots, 3 dots, and then they connect to become a line. So this is my friend's daughter. she draw according to my son's figure. I said, next time you draw the bigger ones for me. But that's like, you can see this is just two meridians, all the points that connects. And actually we have like 14 meridians in our bodies. You can see that the line like all over the body. And it's very interesting. In the very beginning, we have like 365 points and then 12 main meridians, which is, it's like related to like we have 365 days a year and 12 months. But that is the really old like documentaries of like how in the first place they ferment. And now we have 14 meridians and more than 365 points. Okay, so the channel distributions, the meridian distributions are very close to these days the nerve distribution. So I will say this, I don't think like, human being can invest all this, but I don't know who invests that. But it's just like amazing how they can figure out and connect all the dots, become the lines, and pass down the experience to us to the later days, that so we can accordingly to helps with all the problems like non like structure damage problems that acupuncture can help with. Okay, so this is how does this work. It will be so like in now you must have like pictures like needles, points, meridians, but how it can try to interfere with our body. So this is like actually modern research. We can see that they use functional MRIs to kind of study that when this is like you can see the DU15, SI8, SJ8, KI3, KI7. We in the modern days, they categorize each channels. We give it meridians. We give it a name, like our organ names. That we have like lung channels, large intestine channels, spleen channels, and like pericardium channels, heart channels, liver channels. So like KI3 is a kidney channel, the third point on the kidney channel. So when we poke the needles into the point, it has some reaction zones in your cortex. About the spleen 6, the spleen channel 6 point, when there's a difference pop in the imaging in the cortex, which makes sense. So many people that they have experience of acupuncture, when we puncture in, they were scared because it's painful, but actually it's just it's not really painful. Actually, it has like 4 different kinds of sensations: fullness, heaviness, sore, or like pain. But depends on the skill of the acupuncturist, or depends on if you trust the acupuncturist or not. So or it depends on the needles, the thickness of the needles. So that's a feeling, and it activates the cortex. So that's how it interfere with like the body to work with that. So on that, it just through 3 major nervous system tuning up to help with like the central nervous systems, autonomic nervous systems, peripheral nervous systems, to tune up the muscles. If we were talking about the pain, like tuning up the muscles, relieve the nerve, not holding the muscles, make more blood circulations to help with the pain area to recover. So we slowly connect to the dots that how acupuncture will work, and like how make the body into like relaxed modes, so like more like parasympathetic mode, like like you can make the muscle relax, and also you're like when people has like pain and aches, they be moody, they're not so happy, they're so depressed, and also this will help all like kind of wusa in the la la land, like only the people who experience this, they will find out, like they will experience that, like they don't want to get off the bed, the treatment tables after the section is done, or they just have like the good nap taking, and with that, how cool is that, that you have a needle in and you can still like take a nap. It's just crazy. So this is how like a table that's like showing that when we actually insert the needles, how it connects, how we react, the bodies, and certain like changes to relieve the muscles. Okay, I'll leave that for you guys. I just have ideas. So we're going to like today's main topic: how acupuncture like helping the pain. It's like pain the heal or pain management. This is like so many pain managements now. In my practice, I have referral from like pain specialists, like they do like cortisone injections, they do ablations, and then after that, they could still the patient still has the pain. They'll refer to acupuncture to help out with the pain management. I have like a veterans hospital. They refer veterans who are on the opiates, that they don't want to take that much of a drugs, so they refer to me to do the help out with the pain management. So like I'll say some really we can reduce the pain, and some can really into like 0 to 1 of the 10 pain scale, or some we just can maybe limit down. So I'll say that some we can just like managements will be more appropriate that in the like more practical to say. So acupuncture analgesia. This is the like what we do is that when the acupuncture we're putting the needles and into the points, it actually make the body like has the like opiate peptides that's into that the dorsal horn, the pathway to play a key role to make the acupuncture can help with the like relieve the pain level, make it like a drops and all that. Of course, that's it is the sometimes the pain itself is complicated, is involved with the like muscles, the nerve, and the like bone like structure damages. It's so many, but later on I'll talk about like which parts were more like for acupuncture to help, what kind of like issues. So yeah, it is against that, it's helping that to get more like opioid peptides to the bodies, and then to like put the body into a parasympathetic mode to kind of relax the nerve, relax the muscle. Okay. Well, here are some like some like studies, like that they try to find out, like we have electro acupunctures or manual acupunctures. Later on, I will bring that. So it's helping that for like chronic lower back pain to reduce the pain. And like this one is like for chronic pains, like you have, you know, acupuncture to like see like to help the study is like effective for the therapeutic for acupuncture as well. For the neck pains, that it's, you know, like some like showing the relief long terms and to help with the neck pain. So we're talking so much pain, like we can relief, and then it's just like how we approach that for like a Chinese medicine way or the acupuncture way to see how you know we actually do, right? I can share that with you guys that it's, well, in the Chinese days, if you show the secrets, either you treat your opponents better or the best, or you just have to write them. But this is like what daily I do for like showing that. So locate the pain area and finding according the meridians and choose the points, insert the needles. Normally we do like 5 to 20 needles, sometimes it's more. And like sometimes we clip to the electro acupuncture. It's like depends on the intensity or like the time, or like sometimes we have to according to like insurance, like how they pay us, how we, you know, we're allowed to have the you know the patient helping the patients. So we like to using the different type of waves and intensity to help patients. And others is cupping. So cuppings instead. So the whole setup is, first we relax the nerve because nerve guarding the muscles. A lot of times that we having like issue is with in the beginning after the injury or long-term pain. Like if you do rehab, it's hard for them to stretch out the muscles because like our natural body protect mechanisms, the nerve locks up the muscle to protect further injuries. That's why it's harder. So by acupuncture, the first, you know, we work on the nerve endings to relieve the nerve not holding the muscle. Once the pressure of the muscle like holding its release, then the muscles start loosening up. Then we like do some movements to make the blood flow into the fascia area. Then they will start like kind of, you know, nourish out the area, then more circulation. Then patients start feeling, wow, the pain is actually start reducing, right? So that's like the different like treatments to help out. And then also the cupping or toy knot is just the like helping out the compress the fascia and then make the whole pain area like relief and to help out with the pain. So lower back pain here, it's like we can have with just like a bulging disc, what the degenerated disc, or sciatica nerve pain, or like spondylosis, then pinched nerve, or just like pull the muscle, sprain, the lower back, and or like just have like after the surgery, like this patient's, I don't know if you can see clearly that he has a long scar over there. That's the he has like a lumbar fusion over there, and this is actually a patient referring from a pain specialist that you know, they've done so many things, then they refer to like to help out this is a senior patients. So all the numbers on that UB21, 23, 22, that's more localized around the area. Okay, then we have a distal too. So you see that we hook up the electrical stimulations, the TENS units, to help out the local areas to get more blood flow or relax the muscles to helping like reduce the pain. And on the right hand side, that's the afterwards the cupping. That they always like joking is a big run into the big giant octopus, not in the oceans, but in the acupuncture clinic. So it's like, okay, when I tell a patient this is a male patient, so, oh, don't say like, don't tell your wife like Dr. Lee abuse you. But it's just a joke. They know that. So neck pains, this is more localized. Like neck pains, like, you know, hernia disc, or like you have like sleep wrong, like, you know, in the morning that you cannot turn your head, or like I have patients with like workers' comp patients, they get injured from at work, then it's like numbness, tingling down the fingers, like pain, that tightness in the neck area. So this will help out. You know, it's all the around like neck and shoulder areas, the points. So knee pain, like knee pains can cover like torn meniscus, or like ACL like torn, and or just kneecap pain, or like sprain, or after the knee replacements, like lingering pain, nerve pain, that this we can help with that as well. So a lot of times it's that we put on the like electric stimulations to help with pump with the blood flow, to help with more circulations. So this is another different approach. On your ear, that's I'll let you see the next this one. This is actually a neck pain. You'll see that by the earlobe, that's my thumb at, that's actually your cervical. We can see that it's a different, it's not smooth, and that's a structures that pops out. That you can go home and then see your kids, there is so smooth and rounded. For people has neck issues, that they're bad postures, or their cervical curve, that they just look down all the times, you'll see that, or like a bulging disc, or hernia, like degenerate disc, you might see a lump over there. So this is actually, we use that for like the microsystem approach on the ear, that according to these different areas, that on the like earlobe is your eyes, and then like upper, that's a fetus upside down, so head is down, leg is up. So we're gonna use that to like helping with the nerve ending relief too. This is like auricular acupuncture. We're not using needles. Sometimes we use a lancet to punch and let a little bit like blood letting out, to help out with the work on the nerve ending, to help relieve the muscle tightness. Okay. Then the other one is the homological body structures, that we're using the elbow to treat the knee to treat the elbow, or scapula area to treat the hip problems. We often needles that in the scapula underneath to help with the piriformis problem, piriformis or glute tightness and pain area, using the wrist to needles and to help with the ankle. So this is probably blow out your minds that how can that be? But it is working. So this is the lower back pain. You see that we put needles around the elbow area along with the forearms. Actually, you'll see that it's in your forearm. This is the head, and this is the neck coming down. Then the cervical comes down to lumbar, near close to the elbow area. That's the lumbar area. So you can see if you have a right side lower back pain, you try to press your left side's forearm, you might find like sensitive spots around the forearm area. Okay, so on the right side, on top of your head. This is actually it's on the top of your head is your spine too, but the head is the scalp is more like a bone structures. So if it has like a bone problem issues, will more needle touch the scalp. That's a bone to bone. That's a difference. So neck, we was like putting that needles or lancets out on that area to relieve the pain. So for like neck pains or stiffness, you can actually palpate behind your ear around the neck area. You'll find out sometimes people with like neck tightness, the behind the ears is so like hard. It's not soft like your earlobe. It's like harder. And for people who has headaches around like this area, you feel like this will be like so like hot structures, like solid. And then that's why we use that to kind of like helping out with the nerve ending relief. And if it's react to the treatments really well, actually the patients feel relief in like 5 to 10 seconds because we work on nerve ending. The patient always asks me, how come it works? My neck is connected to my ears connected to my neck. I say, yeah, ear has like lots of the nerve, like the nerve is shorter distance to your head. People more familiar with like the foot reflexologies, that all the body is in your feet. And then same thing, all the body is in your ear, and all the body actually is in your arm too. So this is one of my patients that he posts on his Instagrams that came in for like the whole back pain. So I needles from the top from the like upper back to lower back. And differences is like with this kind of pain, like patients that we needle and then let them move. We now needle directly to the local area. We more puts on the distal approach to let them do some movements, and that's when they movements it pumping more blood into the area. You make the circulation better, and they can see their range of motions increase at like slowly by little, and this just happy with that. So the knee pain, actually we put it is on the elbow areas. That's to help like with knee tightness or like this the pain. This is work tremendously, like amazingly. People were just like really don't like that. So for the treatment plans, that's for pain, that it depends. We were like 1 to 2 to 3 times a week, depends on the conditions, or like more chronic, or like for 8 to 10 weeks period. Like then the stretch and then strengthening exercise. That's just the like the patient always asks me that, oh, I have pain relief, like certain relief, but how long are you gonna last? So the key to make the healing process keep going, it's the stretch and strengthening exercise. that will keep the muscle in tune, the joints in tune, and the flexibilities that will be increased. So for my like 10 in my practice, like 7 to 10 patients shows improvements in like 1 to 3 treatments. That's earlier. Some patients, some of the audience say that, yeah, 1 treatment and don't have to go back again. Well, that's very awesome, but that happens into like when what the patients had tell me, oh, 10 years ago when I still young, well, I go in 1 time and then it's gone. I don't never have to go back again. But 10 years later, you're getting everything changes, body changes, your healing process changes, right? So sometimes we need more treatments. So the improvements that for pain, acupuncture for pain, is like more like a pain level decrease, range of motions like increase, and the activity of daily living scores increase. And that's what we're looking for and help out. So insurance coverage for that, like VA community care, major insurance, it all cover under the diagnosis of pain. That's HMAA, UHA, HMSA, and Kaiser. But for HMSA and Kaiser, you need to have like underwriter like American Specialty Health or complementary care, and then you will cover acupuncture. But for Medicare, it's Medicare Advantage. The regular Medicare A and B, they start having covering lower back pain, but that's have only the medical doctors or like acupuncturists that under the medical doctors, MD's supervision, they can then we can do. But the Medicare Advantage programs like AARP, United Healthcare, Humana, or Ohana, they all cover the pain for acupuncture treatments. Of course, the workers' comp and NOFO personal injury plans, it's all listing in like helping the pain, using acupuncture for helping the pain. So, whew. Well, so that's, like, get some questions that from the, like my patients that thought, is that any medications on the needle? Which is no, it's just a stainless steel needle, okay? And so it is pure just using our body's natural healing systems to help out. Of course, there's certain levels that we can do as long as there's no structural damages or like organ damages, like we can through the like fine tunings, the nervous systems, the muscle, and the circulations to help with the pain. All right.
So how much does it cost if you don't have insurance?
Well, it varies. It varies.
I know you can get like 5 treatments for a lump sum.
Yeah, we have like a package deal, but different practitioners has different price setup. Like range from like 50 to 120 per sections. That just I will say it's more like that.
And how many sessions do you think? Do people usually do 5 sessions, or is there an average?
Average, like we will set up like 5 to 10 sections for start, and depends on how the patient reacts to the treatments. Some patients react to the initial treatments really well. Then we just let it like kind of like a 5 sections, or like not as like long term. The patients that need longer time, more sections to see the results.
Got it. Are there any known conditions you should not use acupuncture for?
Well, when you're drunk, or as a pregnant situations, like certain points or certain treatments we have to avoid with the certain points that we cannot touch or not inserting the needles, that just are contraindicated. But normally it doesn't have like, you know, too much effect. When you only thing is that when you like drunk or dizzy, is that the whole circulations, it's just your body circulation will just that you don't, it will mess up the whole like circulation feeling. It's not actually mess up with the blood flow, but it just like the whole energy floating is different.
What if you have a coagulopathy or you don't clot well?
Well, that is good questions, but unless we purposely letting the blood out for different conditions, majority of times it just kind of like puncture the like capillary vessels and it's stopped quite right away.
Can you treat high blood pressure?
Yes, we do.
How do you do that?
How do we do that?
How do you do that?
Which, well, let's say back to like the like we show that like tunes up the nervous systems and the blood circulation vessels and the circulations. For blood pressures, that's if you treat the blood pressures, there's that will go into more like internal medicine parts that we have to distinguish different patterns. Like each individuals, their blood pressure, the cause might differently. Their symptoms or their they all have high blood pressures, but they also have different patterns that we can distinguish and accordingly to help their like their simply say it's the yin yang balance or they're more like balance, but that's more like you have to go into to choose and look at all the pulse, the tongues, and to help out with that way differently.
Right. Do you give herbs also?
Yes, you see the back. This is the herbs. Well, we have like powder herbs, and also we have machines to cook and pack just like this way. It's pre-made. Then you know you don't have to bring the twig, the dirt, the animal like home, and it's just like a cook as a pressure cooker and like seal pack, and it's ready to drink. Easy.
Pressure cooker. All right. Okay, let's see. So I'm going to be your patient. Oh, let's see. Would you say one approach is more effective in treating chronic pain than the other, like distal approach or needles on the direct area? Let's say for plantar fasciitis.
Okay. Well, okay, this is the real world now. All right. For plantar fasciitis, how I treat, I always combine the both approach. So the patients that they can benefit from both treatments. And also sometimes they don't know me or they haven't experienced that. They will doubt how come I put a distal approach to their problems. But that's why I always has both. So for plantar fasciitis, like first I would go for the ear for distal approach, microsystems. And then I would like to find the like foot area, which is on top of your ear, right here, and like from the calf to ankle. And then this way that first I'll loosen up the calf and the muscles and also the bottom foot area to make it the nerve loosen up. Then the second parts will be needles right around like the hands around here. You see, this is like like your foot. That the heel actually is like right here. So that's why we needle that and then tell patients to move. Then the second treatment, because sometimes when you directly approach in the first treatments, is the area is so painful. Then you do it, it might create more pain. So my first treatments, like mostly 80% of the time will be distal approach. And it just like get the pain level drops. So yeah, that's like I will say both approach are like beneficial.
All right.